So I know you mentioned briefly some outcomes for residents. Have you got any specific, again, without mentioning any names, any specific outcomes for any residents where it's affected their care and had a better outcome for the resident themselves?
We've had we've had a few occasions really where we've identified things before it's kind of got to it. We had a lady with a really, really, really high blood pressure. And we that that particular lady, we managed to start on some medications quite quickly.
Do you
We
think
ha-
that medication prevented her maybe going to hospital, or do you think it's that?
oh, yeah, no, absolutely. So I think her blood pressure was, yeah, significantly out of range. With a lot of these patients, it's quite difficult as well. In a normal sort of realm of healthcare, we would obviously ask them to wear a 24-hour holter and we would have a look at what the blood pressure's doing that way. A lot of the patients in this particular care home have got advanced dementia. So, as you can imagine, wearing a 24-hour halter would not be suitable for a lot of these patients. They would just pull it off. So, we did blood pressures morning and night over 5 days, and it highlighted that the blood pressure was significantly high. So, we managed to start her on some medications quite quickly. And we brought that blood pressure right down. Now the lady's doing absolutely amazing. So we had another lady who again had would been showing some really sort of aggressive behaviour. And when we did her blood pressures again, her blood pressures were significantly high. So we had a sort of play about with her, not play about her medications. And then the girls were saying that after we had done that, from identifying through the Whzan, that her behaviour had significantly changed. Again, because these patients have got advanced dementia, it's very difficult to sort of, identify what the causes are. And a lot of the times it has been sort of related to observations. Whether it be, again, another one, like I said to you earlier, we identified a man literally within the last couple of weeks who we were doing his oxygen saturations. He was well in himself. He was eating, drinking, not showing any signs of any chest infections. He is known COPD patient. So we knew that his observations could be low. However, we got some urgent bloods done and the bloods come back and we had to admit him to hospital, actually, this one particular patient. And they found out that he's got reoccurrence of a cancer again. So it's, you know, that maybe would have gone missed because he was well in himself, you know. It was just the fact that obviously observations had changed a little bit, which initiated some urgent bloods.
It's amazing.
Yeah. So obviously, I thought that was absolutely fantastic. And now he's back first and they're going to monitor him going forward. But that could have been missed for quite some
Yeah. So
time.
you caught that early and it's got that early prevention. That's really good.
Yeah.